Welcome to the Susan LoPresti Wellness, Mind, Body, and Soul podcast, the go-to space for midlife and mature women who are ready to reclaim their health, boost their energy, and live long, vibrant, and purposeful lives. Each week, we dive deep into natural wellness, holistic healing, anti-aging strategies, and healthy lifestyle habits to help you feel your best physically, emotionally, and spiritually. Whether you're navigating menopause, working through chronic conditions, or simply wanting to age gracefully and intentionally, this show is your sanctuary for science-backed insights, powerful stories, and soul-nourishing inspiration. So if you're a woman over 40 or 50 looking to thrive in the next chapter of your life, you're in the right place. Today's guest is Dr. Diana Driscoll. She's a clinical researcher, optometrist, and an expert in the autonomic nervous system. After facing years of unexplained illness and misdiagnosis, she shifted her entire career to uncover the root cause of complex chronic conditions. Her journey led to the founding of POTS Care, which is a clinic that focuses on restoring balance to the nervous system and supporting deep, lasting healing for patients with conditions like POTS, Ehlers-Danlos syndrome, and long COVID. Dr. Driscoll is the president of Genetic Disease Investigators and the creator of Parasim Plus, a patented supplement designed to support the vagus nerve function and reduce inflammation. She holds 5 patents and is the author of the Driscoll theory and Ehlers-Danlos syndrome, your eyes and EDS. With a unique blend of scientific expertise and personal experience, Dr. Driscoll is passionate about helping others feel seen, heard, and empowered to take back control of their health. Without further ado, Dr. Driscoll, welcome to my podcast. I'm excited to meet you and have this powerful conversation with you. Thank you for joining.
Thank you for having me. It really is an honor to be here. I appreciate the
You're,
opportunity.
you're welcome. I want to start this conversation with your own personal health journey, right? So, years of unexplained illness, misdiagnosis, and how that experience actually reshaped your career path.
Boy, it sure did, Susan. I'm an optometrist by education, was very happy being an optometrist. And I had a viral infection overseas when I was on a mission trip with a group. We all got the same virus. I can't blame the virus, but I walked away from that once the virus cleared up in a couple of weeks with bizarre symptoms. I'd never experienced anything like it. Heart was racing, I was tremulous, I couldn't sleep, digestion started to be affected, extraordinary fatigue, and those symptoms just kept multiplying. I was eventually diagnosed with postural orthostatic tachycardia syndrome, or called PODS, and worked with the doctors, researchers for years and wasn't getting any better. In fact, every year I was getting worse. And it wasn't a subtle condition, Susan. It's not like I could just push through, I
Yeah.
couldn't finish my last 2 patients the day it hit. I was completely disabled by this. And then about a year and a half into it, my son got a series of viruses. He developed POTS. He was disabled. My daughter was struggling. And because no one was helping us, I could not understand why. I went ahead and set up a corporation. That I'm an optometrist. I have a medical background. I'm a patient. I'm in the body of one. I have children at home who are disabled by this. Maybe we have a chance of figuring this out. And it was an abrupt career path, but I got into research and dove into what was happening with that condition.
Can
Yeah.
you explain what it is, what it's all about?
I can tell you how it was approached. And what you'll hear on the internet is it's a disorder of the autonomic nervous system. And
Okay.
the autonomic nervous system is the part of the nervous system that works automatically. You're not supposed to have to think about it. You don't have to, make your food digest or make tears produce, that sort of thing. You're not in charge of controlling your heart rate. It does that for you. And that it's perceived as a breakdown in that nervous system. And prior to my research, I think all the research was looking for what is affecting the autonomic nervous system. And too many things were getting missed. After years of research, working with patients now for over 10 years at POTS Care, we see in the vast majority of patients, this is an inflammatory condition that
Mm.
is eventually affecting the autonomic nervous system, including the heart rate upon standing. But when that is discovered, and all the dominoes that have fallen in each case are figured out and corrected, the patients can recover. I certainly don't have POTS. My children are not sick, nor do we ever plan to be sick. So it was quite the journey in getting those answers. But today, now, I'm very proud I have 5 patents to date because no one really went deeply into this nervous system. And I had to. I had
Right.
to.
Right.
Yeah.
Can you just explain the difference between the parasympathetic nervous system and the sympathetic?
Yes, that's an excellent question. Someone knows their autonomic nervous system. Yeah, there's a balance between these two. The parasympathetic is the rest and digest. So it allows digestion and allows you to slow your heart rate, slow your breathing, fall asleep, that sort of thing. And
Mhm.
then the sympathetic nervous system is what is the more fight or flight. It's like when you get nervous for something or you need high energy to get through something, the sympathetic nervous system kicks in. And there's a balance. The body has a way of balancing in it. In POTS patients, or I call them inflammatory POTS patients, now the sympathetic tends to get in overdrive and the parasympathetic gets blocked, and you have this big difference between these two. And as a patient, I will tell you, it's horrible. It's like being flooded with adrenaline all the time. I remember early on in the condition, I mean, I couldn't sleep. I was shaking. My resting heart rate was 123. And a friend said, "Oh, so you have a chronic condition? Are you just really tired?" I said, "It's kind of the opposite. It's like I've been being chased by a bear for 3 miles, and then I'm thrown on stage in front of 2,000 people and have to give a talk right then. That's the level, that's my baseline. And losing that balance is just a horrible way to try to live. There's reasons for that imbalance, though. And when those are corrected, you can get that balance back, which is delightful. Yeah.
Yeah. Wow, that is incredible. I've never heard of this before. I never did.
Really?
Yeah.
Yes, it's becoming more mainstream, I think, in conversation because COVID is triggering it in 10 to 14% of patients. We were ready for that. We were already seeing post-viral POTS. I was a post-viral POTS patient, as was my son, for years prior to COVID. But when COVID came to be, I thought this virus could be powerful enough. It's a SARS virus to trigger abnormal inflammation in those predisposed. We need to brace ourselves for that. And that's exactly what happened. So, COVID wasn't that special in that we were seeing this condition long before COVID, but COVID brought it to the forefront more. And now I think that you've heard of it, Susan. You'll probably hear about it
Oh,
all
yeah.
over
Well, once
again.
you hear about it one time, then it'll always
That's
come.
right.
Yes,
That's
I know.
exactly right.
That's
Yeah.
that's the way it is. But I never did hear about it. And even during
Yeah.
COVID, I just had no clue about it.
Yeah.
So, how are these conditions connected to the nervous system imbalance and also inflammation?
Yes, in so many ways. And I wish all of the patients were the same. They are not. Every case is extraordinarily complex. I love a medical puzzle. That's what I did for 10 years, just figuring out my own case.
Yeah.
So, but there's commonalities in patients, and generally you can start with those commonalities and go from there. So some of the commonalities in inflammatory patients are there secondary issues to that. One is the cardiovascular system is affected, cardio meaning heart, so then the heart rate picks up. And it's a response of the heart to some of these inflammatory elements. It's basically a normal response to the heart. The
Mhm.
heart can be checked out, and I'm willing to bet in the vast majority of patients, the structure of the heart is fine. It's reacting to something. And then those chemicals are also affecting the blood vessels. It starts with the inner lining, the endothelium of the blood vessels. They don't constrict properly. Blood tends to pool, worsening everything. And then another commonality, and all of these are in the book, The Driscoll Theory, that came out in 2012. We've moved far past this. Do you know that? But I think for many people, it's brand new, right? Another commonality is a propensity to develop high intracranial pressure. It's probably in, depending on the week, 80 to 85% of the patients we see.
Wow.
And then those who don't display it when we see them, they're still very prone to developing it. And we've seen that happen. So with that high intracranial pressure, that does activate the sympathetic nervous system. That goes up. It's one reason why patients can't sleep. There's just horrible insomnia. But it also decreases the blood flow into the brain. The oxygen perfusion goes down, and all kinds of secondary problems occur with that. And then a major finding that I found was that the nerves of the parasympathetic nervous system aren't working properly because the inflammation is blocking the release of the neurotransmitter needed by the parasympathetic nervous system. And that's where those patents came in, that I sat down and figured this out and basically came up with a supplement, Parasym Plus, to replace that neurotransmitter. The receptors of those nerves work great. I tested those, and the autonomic nervous system could start to balance out. So quite the process, but those commonalities are a good place to start because all of them do affect that balance of the sympathetic and the parasympathetic. Yeah.
Well, and so you started a clinic based on
Yeah.
this, right? So can you tell
Yes.
us a little
Hot
bit about
care.
that?
Yes.
Pot's Care, right.
Hot care. That was, I remember the day I decided to do this. I talked to a friend and I said, all of the traditional treatment out there for POTS is either making the patient sicker or just keeping them sick or both. It's really horrible. They're still addressing POTS almost like it's either a psychological problem, which don't even get me started on that, or mild dehydration. They just need more salt, and increase their blood volume, which is ridiculous. And it further damages both the cardiovascular system and it causes high intracranial pressure. So it's really a poor state of affairs, I'll tell you. But I remember the day saying, I know we can do better than that.
Mhm.
And again, we just celebrated our 10th anniversary a couple months ago. We
Wow.
started bringing in patients and looking for these inflammatory problems, beginning with these commonalities and digging deep into where is this hidden inflammation? And it's usually hidden. The traditional markers for it, CRP and SED rate, what doctors learn to look for, are usually normal. So if we look at those, we won't be able to help the patient. But we can figure it out and lay out a plan with the patient, and then we'd hold their hand through it because by the time POTS develops, it's a significant illness, significant.
Mhm.
We see so much suffering from it. So it is the best job possible. Patients are so incredibly grateful, but it's frustrating because no one else is treating this in this way. So we're pausing right now just to create education, start to train others, so then we can move to the next level for patient care. Yeah.
Wow, that's wonderful. So what does true healing look like for these patients, physically, mentally, emotionally? What's going
Yeah.
on with them?
And I'm so glad you mentioned the emotional toll. I think one of the worst parts of this condition is kind of two-pronged. One is there's little or no validation for the level of suffering patients go through. I remember thinking, well, here I am, I'm a doctor. I was extraordinarily active. I had 5 offices, multiple businesses, completely disabled. They will take me seriously. They will dig for answers. Nope. I eventually got the maybe you should see a psychiatrist, suggestion.
Oh,
Yeah,
yeah.
because it kind of looks like, to the uninformed, it looks like someone's having a panic attack all the time. It is something I tell the doctors, it's like my body's having a panic attack without me. Okay.
Yeah.
But my son was also completely disabled. He missed over 3 years of school.
Wow.
He developed severe osteoporosis. He broke his arm just throwing a ball, just putting on his coat. It wasn't like he was an 8-year-old just wanting attention or something. His heart was racing. Sometimes he couldn't sit up even without fainting. So the
God.
lack of validation for me was shocking. And I thought, I'm just not getting to the right doctor, right? I probably went to 50 doctors. I kid you not,
Wow.
and ended up in clinical trials for it. And I thought, great, these are the best minds out there. They will have some ideas of what's happening. There is hope. And 3 years into it, every year I was getting worse. And I talked to the head researcher and I said, throw me a bone. Give me some idea of what you're thinking this could be. And
Mhm.
he said, well, it's our thinking that POTS patients are perfectly normal. They're just more aware of their own bodies. You've got to be kidding me.
Yeah.
And that's the day I knew, Susan, we were on our own,
Yeah.
right? So that was pretty horrible. And then, two, the inflammatory effects, these chemicals that are released from many types of inflammation, start to involve the brain. And I remember at one point, I mean, you're sick from head to toe. I had a list of like 80 symptoms that would continue to change. And I thought, I can handle a lot. You could cut off my right arm. I can handle it. I can handle pain. I can handle challenges. Why can't I handle this? I think
Mhm.
my brain is involved. And indeed it was. So patients across the board end up with very high anxiety, sometimes almost paranoia. It changes the brain chemistry where what starts out a little sympathetic overdrive where we're very high achievers. That's not all bad, right? We
Right.
tend to be at the top 1% of everything we do. We're very detail oriented, almost OCD in how we approach things. And we expect other people to have that same high bar. We can't live with people because they don't.
Yeah.
Um, some of that is the oxidation from the inflammation. So another supplement I came up with is called NAC Max, and that helps control the oxidation that, again, alters the brain chemistry, calms some of that down, and it stops this loop of inflammation always causes oxidation. Oxidation always worsens inflammation. And patients get caught in that cycle and just end up going down the drain. So we need to break that cycle too. But the effects on the brain is pronounced, and the mental challenges that patients go through is just horrendous. Probably about 40% of the patients we see have admitted to at some point to trying to kill themselves.
Yeah,
And
I could see that because you're
oh yeah,
getting no answers and you almost feel like, what is it me? Am I going crazy?
no kidding. I
Yeah.
feel so lucky, Susan, in a weird way, lucky that
Yeah.
I got sick before my kids did,
Yeah.
because if they had gotten sick first and all of the doctors, all of the specialists were saying, everything looks good, would I have wondered if, are they just nuts? What the heck?
Right.
Fortunately, I was a patient first, and I knew, although it presented much like, some psychological condition, I knew I didn't suddenly have some psychological condition. I had a virus, and 2 weeks later, this happened. So I just could blow all that aside and not even consider it with myself or my children. But we knew the brain was affected.
Wow, that's
My mission, this has
incredible.
just got to change. It's just horrible what patients go through. None of this should be happening. I look back on my 10 years of illness, and I think none of that should have happened. It should not have taken an optometrist from Texas and then another 10 years of suffering to have to get answers for this, honestly. So my personal mission is to change not only POTS and what patients go through with that, but a lot of these invisible illnesses are directly involved to unidentified inflammation. And when they are identified and treated, patients can fully recover. And in POTS care, you'd ask about recovery. We always shoot for complete recovery.
Wow.
Always. Now, some of that recovery involves oftentimes managing some sort of propensity toward inflammation. Once that's identified, there's usually some things patients have to do to stay on top of it. They're more prone to it. So
Mhm.
that way, the next virus or whatever that comes along doesn't start them over with
Yeah.
that horrendous journey, right?
Now, does the vagus nerve function help to reduce inflammation? I wanted to
I'm
touch
so
on
glad you asked that.
that.
Again, this is where the research started, where it looked to me at first like the vagus nerve wasn't working. I had horrible, it started constipation, episodic diarrhea, and then went to full-blown gastroparesis. Nothing was moving. My gallbladder failed, and all of that was neurological. And I remember studying this and thinking, okay, if the vagus nerve is not working well, it would certainly cause these problems, right? And the heart rate would tend to go faster, et cetera. But we have to keep our minds open to, is it a bigger problem? Is it just a vagus nerve problem, or is it a neurotransmitter problem? Because we want to address that differently. So
Mhm.
I sent out symptom spreadsheets over 5 years to patients with POTS, chronic fatigue syndrome, PTSD, interestingly, and fibromyalgia. And in these long spreadsheets of symptoms, I tucked about 30, 35 symptoms of anticholinergic syndrome. That's where acetylcholine, the neurotransmitter needed by the vagus nerve and other nerves, when it's depleted, it presents with symptoms. And the majority of patients had the majority of those symptoms. It would come and go to some degree, but the pattern was undeniable. And I knew this was likely a bigger problem. The bigger problem was that inflammation was interfering with the neurology. So the vagus nerve is an autonomic nerve. You don't have to make it work, right? You don't have to
Right.
be in charge of stimulating it or whatever.
Right.
When the neurotransmitter is getting blocked or it's not being released properly, as long as the receptors work, we just put in parasympathetic, it goes right for the receptors, works beautifully and works immediately. No researchers had ever tested the receptors. This boggles my mind, Susan, when I thought trying to work through this problem, is it a vagus nerve, neurotransmitter, is the nerve damage, what the heck? I thought, there is millions of dollars in research money into looking for some weird autoimmune condition that is shutting down these very receptors. So when I was incredibly ill, nothing was working. My doctors couldn't help me. They wanted that gallbladder out. I said, I think this is neurological. I really want to try to think this through. I could not have a bowel movement. I tested the receptor with an agonist, if you will, a replacement for the neurotransmitter.
Mhm.
And thinking through this problem in bed with no bowel movement for 2 weeks, I thought, if something's wrong with that vagus nerve, I might have a chance by stimulating either the receptor of the nerve or the second part of the nerve. There's two parts to that nerve, and use a replacement for that neurotransmitter. So for the vagus nerve, the replacement is nicotine. And I used a nicotine patch right on the abdomen. It had a bowel movement, in an hour. And it continued to work. Other patients, it worked great. And I knew then it wasn't a problem with the receptor. Those millions of dollars in research, we just throw it out the window. It's not a receptor problem. And that's why they could not find an autoimmune condition shutting down those receptors. And one of those patents I have is the use of nicotine to test those receptors. Now, nicotine is a horrible treatment.
Mm-hmm.
It's a good test, but it's a bad treatment. It's so inflammatory. And by the fourth day of me depending upon it, it was like my inflammation went through the roof. I felt like I was being eaten by fire ants, but it was a great test, right?
Yeah.
So think in terms of vagus nerve, you don't have to stimulate it, works by itself. Neurotransmitter replacement, Paracin Plus will do that. Nicotine is a bad choice. And the receptors always work. So yeah, that was groundbreaking to figure out.
Yeah. But I'm thinking that you're a doctor. So even though you were sick, you're a
Mhm.
doctor and you know a lot about health and wellness and how the body
Yeah.
works. What about a patient who has no clue how the body works? Like you were able to figure out about nicotine. So other people must have, really felt lost. Like, what is going on with my body right now? It's like just
Oh, yeah.
betraying me on all levels. It's
Yes, Susan,
crazy.
absolutely. And I hear from patients, I do consults all over the world. And I hear even in other countries, they say, oh, well, our country, fill in the blank,
Yeah.
is just a wasteland, for understanding POTS. They don't understand this inflammatory component. They don't know what to do. So no, that's everywhere. That's
Yeah.
everywhere. I've been waving this flag for, well, 15 years now, which is changing things, which is great. But it's shocking how slow changing traditional protocol is. And I understand doctors want peer-reviewed clinical trials, then it needs to go into textbooks, and then they need to take it forward in their practice. But honestly, patients can't wait the
Right.
20 years that that's going to take. So I was called the patients researcher at one point, and I thought, yeah, that's good. We do enough research to figure things out, but we don't take 5 years waiting for a grant and then another five to do
Right.
it. Kind of trial. We just figure it out and move fast, and we're helping patients today. So it's one reason my goal is shifting some to teaching.
Yeah.
We've got to teach, and not just in the US, right?
So discuss the Driscoll theory and how it's changed
Yeah.
the way clinicians view certain chronic illnesses.
Yes, that was quite the thing, publishing that. That was poo-pooed by so many experts for
Oh,
so
really?
long. Oh, yeah. Until they realize, oh, it's right. It's been proven many times over. Probably I need a layman's version. It goes very deep into the science. But at that time, no one had considered any of these commonalities, like the risk of high intracranial pressure. That wasn't even on the horizon as a possibility. That shifted the world. And now there's all kinds of doctors either trying to identify it or treat it, or Facebook groups or whatever, which is
Mhm.
amazing. The vagus nerve. And again, it's most of the science out there is wrong, but you can see the shift in thinking, and that has kind of helped too. The cardiovascular commonality, COVID's kind of helping with that a little bit, because at least they recognize with many post-COVID patients, this abnormal inflammatory response is what is keeping patients sick, or what kills them. It's not the virus itself, it's the inflammatory reaction. So, in many patients who are severely ill in the hospital, they learned like IV steroids will sometimes bring it under control. So, although COVID has helped explain this inflammatory reaction,
Mhm.
where patients still struggle is when doctors have ruled out the lungs, the heart looks okay, et cetera, then they still end up in the same position most POTS patients are. And they still get the talk of, maybe you need to see a psychiatrist. Maybe this really is just anxiety, and they just drop the ball, which kills me. So the pace of changing all of that to me is incredibly slow. It's incredibly frustrating. So we're on a mission to change that. One of the problems, Susan, is that the labels are horrible. even the label of POTS is almost meaningless. It's postural orthostatic tachycardia syndrome implies it's a heart problem.
Hmm.
You ask any doctor who's out in practice in any other field, and they'll go, POTS. Oh, yeah, that's a heart problem. No, it's not. The heart's reacting. It is, but it is not a heart problem. So I think the labels need to shift more toward whatever type of inflammation the patient's dealing with. And one of my goals is to lay out the genetics of this. So patients then know from a very young age if they're prone to something, they can kind of keep an eye on it. And then if a patient is sick, they have that validation of something objective in their genes and in their blood work. And they don't have this vague, chronic fatigue syndrome, POTS sort of thing, which is basically meaningless. Yeah. And frustrating.
I wonder how many patients who were diagnosed with chronic fatigue actually have.
Tons. Tons. That's where I say that diagnosis of POTS is almost meaningless. There is something objective. You can have the patient stand up and the heart rate starts to increase. What killed me about this is when I was tested, my heart rate went up 60 beats just on laying on this tilt table, just laying there. It was a dramatic change. They said I had a flaming case of POTS, and they said, but all of the other autonomic tests appear normal. So maybe you just need to meditate and have salt.
Oh,
It was,
really?
they just took that leap from this incredibly dramatic presentation, incredible illness to just push through, basically, and forgot everything in between. They could be driving that.
Yeah.
So that label, although it's objective, it still ends up being a dead end. Every patient we see at PodScare, I don't think there's ever been an exception, has extreme fatigue. Okay. And I do think with chronic fatigue syndrome, the patients need to get vertical. And unless they're on some medication that'll slow the heart rate, a lot of those patients will probably pull over to the POTS group. But then you put them in that POTS group and it's another dead end label. Yeah.
Wow, that's incredible.
Yeah, it's tough.
So patients really need to be their own advocates, especially when facing like complex or misunderstood conditions. And even though it's not similar, it kind of
Yeah.
reminds me of years ago menopause when
Yes.
doctors would actually like they would say that it was a psychological thing and send
Oh,
them,
yeah.
yeah, like
Susan, when I
dismissing
first got
those symptoms.
Absolutely. When I first got sick and was seeing those 50 doctors, I saw a doctor and he said, well, maybe let's check your hormones.
Yeah,
I had this snarky response. I said something like, the last time I looked, hormone changes don't cause autonomic dysfunction. What the heck? My hormones were fine, but I just remember feeling so insulted. I
yeah,
said, I'm dramatically ill. You don't think I could push through hormone changes? I'd had two kids, so what?
right.
That's just crazy to me. But yeah, I do think, as hard as this is to say, I do think this has not gotten the attention and the true science it needs because many more patients with POTS are female than male.
Oh,
Probably 90% of the patients we see at PodScare are female. I mean, my son wasn't female, right?
right.
And 10% are male, but females are more prone to it. And there's reasons for that. And it's not because they're weaker. Somebody told me, oh my God. No, it's that type of inflammation. So, yeah, I think that's hindered some of the progress, which is
Yeah,
very discouraging. But I think I was put in that perfect position, more or less perfect, to try to figure things out and had to go through all that. So it's not a journey I would want to relive, but it lit a fire in me because now I have this passion to change things for patients. Yeah.
right. And I feel like patients need to be their own advocates as well. And
It is so hard when you're so sick.
yes, I know.
Oh, I remember going to doctors and giving them journal articles or something. Well, they don't want to see that. They have 8 minutes, to label you, give you a medicine, get you out the door. And if the label is POTS, it's high salt, it's beta blockers, whatever, and the patients are still sick. Doctors hate to see POTS patients. And it's very difficult to advocate for yourself when someone's not believing you're that sick.
Yeah,
I couldn't even advocate really for my children. All I could do was validate them
yeah.
and tell them I believe them. We are going to figure this out. We're not giving up. I will never give up. But the doctors wouldn't, no, no.
There's emotional toll on chronic
Yeah.
illness, right?
I set up a Patreon called POTS Rebels for this very reason. I did not have any source of support going through my illness, and which was probably necessary because then I had to lean on myself, and
Mm-hmm.
figure things out. But patients going through that without either an advocate or somebody who's been through it and can say, there's hope. We're going to figure this out. What a lifeline. So I set up POTS Rebels and putting everything I can into that for education. We meet regularly, answer questions, and offer that hope and support. Yeah.
Wow. So, touch on how my listeners can start to tune into their bodies and
Yeah.
recognize signs of nervous system imbalance
Yeah.
early.
That's such a great question, Susan, because at once POTS was figured out or helping patients, I reached beyond that to
Uh,
you don't have to have POTS to develop disorders of the autonomic nervous system.
right.
Inflammation is interfering with it. There are many reasons for inflammation, everything from, oh, endometriosis, autoimmune conditions, aging. We talked about menopause. Could we be more proactive in our own health as we get older or whatever challenges we have? If this invisible inflammation is creeping up, tend to get as the autonomic nervous system is affected, we'll tend to get more sluggish digestion, more fatigue, more brain fog, dry eyes, that sort of thing. If we're proactive in it, is there a reason we have to go through all that? Do we have to have the old age, decline? Is that really necessary?
Right.
I am on a mission to say no. And part of that involves I'm very proactive with my own health. I've been sick, or I was sick for so long, I don't ever want to go back to that. But I also want to enjoy my life until the day I'm buried. So very proactive with brain health, the autonomic nervous system, some of those supplements we talked about. I stay on some things to not only maintain the health, but preserve the vascular health, the cardiovascular health, digestive health, brain health, everything is important to me.
Mm-hmm.
And I think I'm the most active person I know. And I'm in my 60s. Of any age, I think we can do so much more with our own bodies and watch for signs, like I mentioned, the sluggish digestion or brain fog or fatigue. It's very easy to say, oh, I'm getting old or I'm not eating right or whatever. It might be the autonomic nervous system. And we can stay on top of that.
Yeah.
Yeah.
Wow. This was a great conversation. What are one or two simple lifestyle or mindset shifts that we can make to help to restore the autonomic balance?
Yes, I think mind shift number one has to be, especially for patients who are severely ill, like I was, and the ones at POTS Care, is never give up hope. Hope is very powerful and it can help carry you through quite a few things. So even though patients may not have their answers right then, it may have to evolve, there's always a reason for illness, right? And
Mm-hmm.
then again, what I've learned is to take good care of your health, be very proactive, do everything in your power to maintain your health, and the autonomic nervous system follows, right? Inflammation interferes with the immune system interferes with the autonomic nervous system. So take care of yourself, do everything in your power to maintain that health. The autonomic nervous system will maintain. Yeah.
Yeah. So for regarding inflammation, um,
Mhm.
Let's touch on diet for a moment because if you're eating a lot of processed foods, doesn't that create more inflammation in your
It
body?
does. It does. And I think you do have to pay attention to that. When I got sick, nutrition was a hobby of mine. And I was in great shape. I taught aerobics classes and stuff. So
Mhm.
when someone suggested maybe you need to exercise and change your diet, I took offense to that because I said, I am disabled. And I was in great shape and ate very well before I got sick. This is more than that. Okay. Having said that, we absolutely need to pay attention to that. That's one of those things in our control, right?
Yeah,
And when patients do, just let it go because you're so miserable, and you eventually get to the point you just need comfort food, they'll decline further. If blood sugar is involved, then we see a real decline. So absolutely pay attention to that. It's just so hard to do when you're that miserable,
yeah,
right? Yeah.
absolutely. Any final thoughts you'd like to leave my listeners with?
Well, I appreciate you offering to let us share this information because there's so many people who are suffering needlessly that really should not be happening. I'm very grateful to you. But I think the words of hope are probably the most powerful. It can be very difficult, some of these invisible illnesses, to get through the mental turmoil as well as the physical. I'm here to support as many people as possible and to teach as much as possible and eventually change these labels so that patients don't stay stuck in this horrible position. But number one, don't ever give up and do everything that is in your power to help yourself. Like you mentioned food. I remember at one point I read something that said movement is important. If all you can do is wiggle your toes, wiggle your toes. I thought, oh, I need to take this more seriously. I can't just be bedridden, and just lay
Yeah.
here. Oh, okay. I need to do everything I can. And that philosophy to this day is still how I live. So do everything in your power. Yeah, absolutely.
So you are in complete, I don't want to call it remission, but you are completely healed at this
Oh,
point.
absolutely. There is no possible way I would want to see patients with POTS if I hadn't figured out my own case and others and then created a lot of the research to get the answers. That would just be a thankless job,
Yeah.
right? Yeah. No, absolutely. And I don't
That's
ever hear these.
incredible. That is
Wow.
incredible.
Thank you. It was a process, I'll tell you.
Yeah.
Yeah.
Exactly how many years did you struggle?
I was sick for a little over 10 years.
Wow.
I know, right? Praise God, I didn't know it was going to be a 10-year journey. If someone had said it's going to be 10 years, I would have jumped off a cliff. Um,
I'm sure.
oh, yeah. You get hit by these waves, and POTS patients will relate to this, I think. Waves that your heart starts racing, you feel real panicky. It feels like your body's self-destructing. You get hot. It feels like there's this fire from the inside out, and you can't stop it. It's just so much suffering. Yeah, and to see my son go through it and say, he was 9 years old. He said,
Oh,
Mom, you have to understand, I can't keep doing this. I can't go even one more day. Oh, heart rate.
wow.
So
Wow.
yeah, it's a lot of suffering that should not be happening. Yeah.
Well, thankfully, you both came out on the other side, and hopefully, patients will as well. That
Oh,
have.
they absolutely,
Thank you
absolutely.
for coming on and
Thank you.
sharing this information with us.
I
And
appreciate it,
yeah,
Susan.
I wish you the best.
I enjoyed it. Thank you.
Same here. Stay well.
I will. You
Okay, take
too.
good care. Thank you so much for listening today. I appreciate each and every one of you who come on and share this information out with your friends and your family. I just want to leave you with some additional information of how you could reach Dr. Driscoll. You could go to potscare.com. There's over 115,000 users on there. Vagusnervesupport.com, drdianadriscoll.com. And as well, you can also contact her at info@drdianadriscoll.com. And I will put all of that in the show notes as well. All her social media platforms and all of the websites where you could get additional information. Again, thank you so much for listening. Until the next time, be well, stay happy, and bye for now. Take good care, everyone.